Did you know that the amount of calories you eat could be driving your inflammatory disease, your chronic pain, or your autoimmunity? I'm Dr. John Bartemus, and I'm putting the pieces together to help you live a life at optimal. Now, what I just said may not be a new discovery to you in your mind, but the mechanism that I'm going to talk about in this video is probably something you've never heard of. So, as I said, the amount of total calories you eat determines or contributes to the amount of inflammation going on in your cells and in your tissues. Calories made up by glucose or sugar, fatty acids, cholesterol, and then other things such as uric acid crystals that are found in gout and hydroxyapatite crystals that are found in osteoarthritis all drive intracellular free radical production that leads to inflammation in the cell and causes the cell to explode. One cell exploding then causes the other cells around it to start the same mechanism and exploding. And all of a sudden you have inflammation in a given tissue going haywire. This is called inflammasome activation from a scientific standpoint, but from a layperson standpoint, it's driven by too many calories or too much energy intake. And it doesn't necessarily have to be poor quality food. You could be eating great food, but having too much or too high intake of glucose or cholesterol or fatty acids and be driving this cellular fire or cellular explosion, where too many calories or too much energy intake equals inflammation or fire or cell death, which then translates to your symptoms: chronic pain, autoimmune flares, type 2 diabetic worsening of symptoms, metabolic syndrome, insulin resistance, atherosclerosis. So the amount of calories you're taking in directly impacts disease processes and your risk of flares or worsening of those diseases. So what can we do about it? Well, there's lots of research on caloric restriction and fasting and things of that nature. And the research shows that caloric restriction extends lifespan. And one of the mechanisms of that is the fact that the caloric restriction decreases the input of factors that drive this cellular inflammation. So if we practice something like intermittent fasting, we're creating increased autophagy inside cells, which basically means these cells are taking care of junk that would drive inflammation, and it's not happening. So the fasting increases the autophagy, decreases the cellular, decreases inflammation, decreases drivers of chronic pain and disease processes. So if you suffer with type 2 diabetes, if you suffer with gout, if you suffer with osteoarthritis, if you have autoimmune disease, all of these things can be helped by determining what is optimal for you in terms of caloric intake and not over consuming. And if you are in the kind of routine of over consuming, then introducing caloric restriction to your lifestyle may be very important for you in helping decrease your symptoms and improving your quality of life. So you want to look into, say, intermittent fasting and discuss with your doctor if that is something that is right for you. By doing that, you may decrease symptoms, improve quality of life, and slow the disease process.